Good morning, I'm Alexis Del Cid in for Jessica Lovell. Welcome to the Morning Medical Update. These days, with early detection and improved treatment, some cancers are thankfully very survivable. Today, we're learning more about one kind of cancer, though, that still remains tough to treat: pancreatic cancer. While the 5-year survival rate has tripled since 1999 from only 4% up to 12%, that's still only a 12% survival rate, which means there is much more work to be done. And today we're learning the very first symptom one man felt before his diagnosis. We'll find out why chemotherapy was even worse and tougher than he anticipated, and we'll ask about the new research and even a vaccine for this cancer that is giving patients and providers such hope. With me today is Chris Barreca, who was diagnosed with pancreatic cancer in the summer of 2020, as well as Chris's doctor, Dr. Anoop Kasi, an oncologist focused on gastrointestinal systems here at the University of Kansas Cancer Center. Thank you both for being here. I want to start with Chris. Chris, what's the status of the pancreatic cancer?
Well, I believe it's in remission. I was finished chemotherapy a few years ago, and I go back and see Dr. Kasi every 3 to 6 months, and fortunately, there has been no recurrent signs of cancer. So. And
when we talk about those percentages at the beginning, that is awesome.
Oh, I feel incredibly lucky and fortunate.
Remission.
So, yeah.
When was the last time that you saw Dr. Kasi?
Well, I don't see him quite as frequently as I used to, but I did in fact see him about a month ago. So my last checkup was in January. So I saw him. Clear? It was all clear, yeah. So.
When we go back to the days right before your diagnosis, June of 2020, you're in the height of the pandemic, so everybody's already amped up and conscious about their health. What were the symptoms that you noticed? And were you home in quarantine during this time, or like all of us were on those stay-at-home orders?
Yes, we were all home, and I woke up one night and had this unbelievable pain in my abdomen, and I didn't know what it was, but I knew it wasn't right, and I knew it wasn't something I've ever really experienced before.
Like a stabbing pain?
You know, it's more like deep inside me, like internal. I don't know how to really describe it, but it was really bothersome, and I didn't know what it was. I didn't know if there was something wrong with my gallbladder. I had some type of ulcer. I really didn't know, but I did know something was the matter, and I tried to just let it go for a bit to see if it would go away. And you know, after about a week or so, I really started turning yellow. Got real jaundiced.
I want to ask you about that because I've never talked to someone or met someone who's been through jaundice. Does your skin turn a deep yellow? Just your eyes?
My skin turned yellow. My eye, the whites of my eyes turned very yellow, and it made me my skin like really itchy for some reason as well. So it was very noticeable. So it was a different color for sure.
At that point, so many of us were putting off going to doctors. We were just putting everything off because we were so worried that we would catch COVID. Were you reluctant to go into a doctor, or did you head straight to the ER urgent care?
Once I started turning yellow, I went to the doctor. That was one of my reasons for trying to hold off initially, but once I turned yellow, I knew something that was seriously a matter, so I went to see my primary care physician first, and he did some blood work and then called me back the next day and kind of told me something was the matter with my pancreas, and then told me to go to the emergency room, and I did. So.
And then at what point did they say, it's cancer, you have to go to the University of Kansas Cancer Center?
When I was at the emergency room, they did some different scans and tests and blood work, and that's when they kind of made me aware that cancer was the likely culprit of all this. So,
oh my gosh.
Yeah, it was an interesting day for sure.
I'm sure that was awful.
It was challenging. It was tough.
And how did you wind up here at the Cancer Center?
Well, the emergency room I went to was just one that was close to my house, and then once it became apparent that cancer was the likely cause of everything that was going on, I wanted to go somewhere where I felt like the doctors were more frequently seeing that type of problem, and a hospital that had more access to resources that could potentially help me. So that's when I made the decision to come here. So.
You weren't making these decisions alone or going through this alone, even though it feels like such a lonely time when you get that news. You have an incredible family.
Yeah.
And you've shared some pictures with us.
Sure.
Of your family. Who are we looking at in this picture?
That is my wife and my fifth of 6 kids, Chris.
6 kids.
6 kids, yeah.
Wow.
That's why I have no hair left. But yeah, we have 6 kids. So.
And what are their age ranges?
My oldest is 25 and youngest is 16.
How did they handle the news?
It was tough. I mean, it was tough. It threw everybody for a loop. We weren't expecting it. There was a lot of tears shed when we first broke the news, but we're a resilient group, and it soon became a focus as to what we could do to help me get better and what they could all do to help me in that process. And you know, I'm very lucky. I couldn't have done it without them.
You were 42, 40?
I was 45 when I was diagnosed.
So young to get that diagnosis. What stage was it at?
I think it was like stage 2-ish. It was kind of localized right around my pancreas, but it did spread to a couple of lymph nodes kind of right around the area.
Wow.
So.
I want to bring Dr. Kasi into this conversation. Dr. Kasi, Chris had pain and jaundice. Are pain in the abdomen and jaundice typical of pancreatic cancer?
Yeah, no, that's a good question. Yes, pain and jaundice can be typical for patients with pancreatic cancer, depending on where it's located. So if it's in the head of the pancreas, that's when it can kind of block the bile duct and can lead to yellow color or jaundice, as well as pain. But there could be some other non-specific symptoms too, like loss of weight, loss of appetite, fatigue. So that's the challenge with pancreatic cancer. I think in Chris's case, I would say the jaundice led to more of an earlier diagnosis at a stage 2. In other cases, if it's in the body or the tail of the pancreas, it may be hard to catch them at an early stage, as there could be non-specific symptoms.
Is it possible to not have any symptoms until it's too late for this kind of cancer?
Yeah, I mean, there would be some symptoms which are very subtle, so that's the challenge. Patients or people may not notice them. You know, if they're on a diet program to lose weight, that may appear that they're losing weight because of their, you know, good healthy diet. And especially if it's in the tail of the pancreas, where it's not going to cause any obstruction to bile duct system or the pancreatic duct, then they may not necessarily have any significant symptoms, very subtle symptoms that they may not notice until it has spread, let's say, to another organ like the liver or lung, and then start causing problems.
So Dr. Kasi, is there a screening that we can ask for to try to detect this early or see if you're at risk for it?
Yeah, that's a great question. I think there's a lot of effort going on in that realm, especially at the national level, international level. However, right now, there's no standard screening procedure for all comers, you know, for normal people. However, patients or people who are at high risk to develop pancreatic cancers, that they carry certain what we call as germline mutations that are at a higher risk for hereditary pancreatic cancers. And also those who have precancerous lesions or cysts in the pancreas, they are the ones who undergo screening procedures, either imaging or endoscopies on a routine basis.
Is pancreatic cancer genetic? Is there any more risk to Chris's family? He's got a huge family.
Yeah, so there is about, I would say, 10 to 15% of pancreatic cancers can be inherited or genetic. And so it is a recommendation for all patients with pancreatic cancer at any stage of diagnosis. They should see a genetic counselor and undergo what we call as germline testing. And so we did that for Chris, and he did not have any underlying genetic mutation that would be disease-causing or pathogenic.
Just the cards that you were dealt in this life.
Yeah, just the way it happened.
The treatment is pretty extensive. The plan was surgery and then chemo. The surgery was something called a Whipple procedure. Very complicated surgery. We're going to simplify it for you. The surgeon will remove part of the pancreas, gallbladder, and small intestine during a Whipple procedure. It actually has a much longer medical name that doesn't roll off the tongue like Whipple. It's I'm going to try to say this: pancreatic duodenectomy. Did I say it right, Dr. Kasi?
Yes, that is correct.
All right. That's a first. Dr. Kasi, what's the main goal of the Whipple procedure? Why do you remove the parts of the gallbladder and small intestine as well as the pancreas?
Yeah, I mean, as you can see in the images there, you know, especially in Chris's case, the tumor, the mass was in the head of the pancreas, which sits in very close proximity to the small intestine, the first portion of the small intestine called as the duodenum. And also the bile duct system runs in through the head of the pancreas and opens into the small intestine. So once you take out the cancer, we don't want to get wide margins, so which is the head of the pancreas, and we want to resect and cut out the draining lymph nodes. So once you take that out, then automatically these loop of the small intestine called the duodenum has to come out. And with that, the bile duct system and the gallbladder would need to come out. So hence, it is a major surgery that way, if you look at it, and requires a lot of reconnections.
Sounds like that would be a huge surgery to recover from. How long did it take you to recover from the surgery before you could start chemo?
It was about 6 or 7 weeks. I was in the hospital for about 6 days, and then another 6, 7 weeks after that. The incision I had was being a little stubborn with closing all the way. So it.
How big is the incision? Where do they?
It basically runs from one side of my abdomen to the other. So it's a pretty.
So
big
you had a lot.
It was a big incision
going on.
Yeah.
And then comes the chemotherapy.
Correct.
Which I want to ask you about this because you had to go quite a bit. How often were you in?
I was going every 2 weeks for about 6 months.
You said it was tougher than you could have imagined. You knew it was going to be hard.
Yeah, I wasn't expecting it to be any walk in the park or anything like that, but it was tougher than I thought. Just the constant fatigue and nausea and feeling weak, and I was a pretty independent and active guy before that, so it was hard to just not be able to do some of the things that I was accustomed to doing. So it was challenging.
Especially if you're used to being up and at 'em every day, running around with your kids and your family.
For sure.
Dr. Kasi, was Chris's chemo plan more intense than most plans?
Yeah, I would say so. I mean, pancreatic cancer is an aggressive cancer, and so we want to be aggressive with our treatment approach. And especially in a patient that is young and fit, then we would go with 3 chemotherapy drugs after surgery, called as FOLFIRINOX, and that is what Chris received. So to date, that's the most aggressive treatment regimen that we have.
So when did the treatment stop? How long have you been out of those treatments?
It was March of 2021. So it's been 3.5 years or so.
A year after you went through the whole pandemic, going through surgeries and this cancer treatment. I mean, the pandemic kept going, but that first year, that was your world.
It was kind of good and bad. I mean, it was bad because I had to be a little extra cautious because I was obviously at a high risk for having something bad happen if I got COVID. But it was kind of good in a way because I was at home, but most everybody else was. So
you didn't have FOMO.
No, yes. I didn't feel like I was missing out on too much.
Yeah, everybody was in it, and your family was supporting you.
Yeah.
What has life been like now, post-cancer? If I can say post-cancer, because you are in remission, what's it like now?
Life has been fantastic. So as much as I enjoyed seeing Dr. Kasi every couple weeks, I'm glad to not be doing that anymore. And there's not a day that goes by where I don't wake up and feel just very fortunate and lucky to, so I try to make the most of every day.
When it comes to the emotional component, there are so many cancer survivors who say you never move on entirely because it's always in the back of your mind. Do you have a lingering thought in the back of your mind, a lingering worry?
You know, I really don't. I know everybody's a little bit different, but I don't worry too much about what has happened in the past or worry about what negative things might happen in the future. I just try and stay focused on the present and enjoy the good times while I'm in them, because sometimes they can come and go and you just don't recognize them. So you know, I try and stay more focused on the present. So.
And the 12% it's 12%. Someone's got to be in that 12%, and you're in the 12%.
Yeah, and that was one thing that gave me hope. Is I met somebody before I started my process that had made it through, and it just gave me hope, knowing that there are, even though the numbers aren't in your favor necessarily, there are people that do make it through, and I was just hopeful that I could be one of them. So. And
now look at all the people you're giving hope to now.
Yeah, hopefully that's the case.
Probably people watching right now in our audience who are feeling very frightened, and you're sitting here to tell them it can be okay.
Sure, yeah.
Dr. Kasi, there is something very promising on the horizon. This is so cool to hear about this. Clinical trials are underway right now for vaccines for pancreatic cancer. Now, these don't stop the cancer from happening in the first place. They work in another way. Can you explain it to us?
Yeah, sure. I mean, it is really an exciting time from being able to offer patients these clinical trials with vaccines, especially for pancreatic cancer. So not everybody is as lucky as Chris, where then you undergo surgery and then undergo aggressive chemotherapy to kind of wipe out cells that may be floating around. So that's what we are trying to target. So after surgery, there would still be some cells floating around in the bloodstream that we cannot see necessarily, and that's what we want to target with chemotherapy to clear them. And then we do monitoring, close monitoring with what we call as MRD or ctDNA. So we had been doing that for Chris as well, and those had been negative after chemo. So he was lucky that way, but there are a lot of patients where it can be positive, which means that there are circulating tumor cells in the bloodstream, and so they're at a much higher risk of this cancer coming back. So that's where we have vaccines for pancreatic cancer. We have the mRNA vaccine, which had shown some preliminary signals in clinical trials of some efficacy. We still have to wait for the readout of the complete trial report. And then here at the University of Kansas, we have a vaccine targeted against KRAS mutation, which is very common in pancreatic cancers. More than 90% of pancreatic cancers have the KRAS mutation. So we're treating these patients with a vaccine plus minus an immunotherapy called a checkpoint inhibitor. So hopefully this provides opportunity for our patients to participate in the clinical trial. These are ongoing efforts, and more to come as the trial continues to accrue and we start seeing reports of these trials.
So this vaccine, while it wouldn't stop it from happening, would stop it from coming back in people who've survived pancreatic cancer.
Yes, exactly. That's right. We're not using it as a primary prevention to prevent cancer in the first place, but patients that undergo surgery and still have cells floating around, those are the patients that would be eligible for these trials with a goal to prevent the cancer from coming back, because you're training your immune system to attack those cells that have the mutation or the marker.
When do you think FDA approval could happen?
It's going to take a little bit of time, at least another 2 to 3 years minimum is what I would say, because we want to wait for these trials to be complete and then wait for a follow-up of that in terms of survival results.
Got it. So a vaccine to keep any cancer from returning would be a huge difference, just a game changer for so many cancer survivors. We have plenty of questions coming in from our community. You can send those to us right now in real time. We are on YouTube, Facebook, the X platform. You can also email us right now. The links are right there on your screen. We'll answer your questions throughout the program. We're going to give you a chance to send those in. In the meantime, I want to check in with Dr. Dana Hawkinson, the Medical Director of Infection Prevention and Control, with our COVID count. Dr. Hawkinson.
Yeah, we didn't have the numbers yesterday morning for this week, but we did get them later in the day. We were actually pretty stable at 24 active inpatients, and a few of those in the ICU and on the ventilator as well. So numbers are holding steady. Hopefully we can see those numbers go down overall. Would like to say there was a question also about lingering colds for 2 or 3 weeks. Haven't heard anything new. I don't think there's any new viral isolates or anything like that. I think it's just common cough and cold, and some of these symptoms may linger on. We know that is common and that has happened. I think some of these things, though, Alexis, just have been brought to the forefront, and maybe people are paying just a little bit more attention to their bodies maybe than prior to the pandemic as well. So nothing else new on the horizon at this point as far as common cough and cold viruses. I would just treat symptomatically as you need to if you are having some of those lingering symptoms.
Everything has changed since COVID. When someone sneezes now, everybody looks at the person who's sneezing. Or if you cough in a public place, at least I feel the urge to say, I don't have COVID. Everyone's not just hyper aware of this. We do have a couple of infectious diseases besides COVID that are making national news right now. First one is something called Alaska pox, which has taken the life of one person in Alaska. And then we've heard about a rare case of the bubonic plague found in a person living in Oregon. First of all, what's Alaska pox?
Yeah, so again, I'm going to encourage our viewers to not get too excited about this. Stay calm. It is very unlikely there will be a next pandemic due to Alaska pox. Alaska pox was a virus that was identified in 2015, so we've known about it for some time. It really is believed to be circulating in small rodents up or in around the Alaska area, such as shrews and voles, things of that nature. There have been a number of human cases, a handful since 2015. This case is of particular concern because a patient actually died of it, but we would say that that patient did have severe immunocompromise as he was getting chemotherapy for cancer, and he was also older as well. There have been no human-to-human transmission of this virus and infection, but it is an orthopox virus, so it is like smallpox, it is like mpox or previously monkeypox. So conceivably, if you do have people that are touching and maybe there are these viral lesions that occur on the skin, if they are able to transfer some of those secretions or drops from those viral lesions to another person, you could have human-to-human spread, but as of right now, there has been no human-to-human spread. Again, it's extremely unlikely that it's going to cause any significant problems. This person probably got it from his animal that was probably out catching these small rodents, and then either got scratched by the animal or somehow got it transferred from their pet animal to the person in general, and to that patient. So overall, not a big issue at this point in time. Would just kind of encourage the public to stay calm and not get too worked up over this.
It is, to put it in perspective, it's one person in Alaska. This hasn't affected any other people. And then we have the single case of the bubonic plague. Bubonic plague, I think, of the 14th century.
Yeah.
Are there vaccines now for the bubonic plague?
It is a bacteria that causes this. It's called Yersinia pestis. It is actually very common out in the groundhog community, way out in western Kansas. We also know that there are cases yearly of isolated infections from this, not always bubonic plague, but localized skin infections. For instance, in western Kansas and Colorado, in the Four Corners area, this bacteria still does reside, especially in those groundhog or ground squirrel populations out there. This is obviously unique, as somebody died from this up in Oregon. Again, it is believed that it had to do maybe with their own domesticated animals, their cats. I think that this patient had a cat. So I think really the moral to this story is, for the public, don't get too upset over this, but I think it does really need to be stressed that if you do have animals, it is vitally important to be responsible for those animals. So certainly we know bubonic plague can be spread through flea bites. Those flea bites can be biting the animals, and then of course if you have animals, those fleas can jump and bite you. That is suspected how this case of plague was spread. So it's vitally important, if you do have animals, please take good care of them. Get them their anti-flea and tick medication, things of that nature. Get them their yearly shots. All of those things will help reduce the chance of spread of these diseases, but also other diseases that may be out there as well.
Thank you, Dr. Hawkinson. Want to get to our community questions now. They're rolling in. We have a Facebook viewer has a question for Dr. Kasi. Dr. Kasi, Jean wants to know how you spell the mutation you were talking about, KRAS?
Yeah, so that would be KRAS, KRAS mutation.
Okay. KRAS. There you go, Jean. Jennifer wrote in. Jennifer wants to know, is there anything, Chris, that you couldn't eat after having the Whipple procedure?
Well, the pancreas does produce some digestive enzymes, so I do have to take a medicine called Creon before I eat to help me digest food. But
every meal?
Every meal, yeah.
Okay.
So I can eat most everything. I try and stick with like leaner meats and fruits and vegetables. I'm not eating a lot of steak dinners or anything like that anymore, but most everything.
Stick with the Mediterranean diet.
Yeah.
Are you allowed to drink alcohol?
Nobody's ever really told me I can or can't, but I don't anymore. So I just figured it was better to be safe than sorry. So
We keep hearing doctors telling us it's not good.
yeah.
Even the
I've
one
heard-
glass a night, unfortunately, for people who enjoy their wine, we hear it's not being touted as a great thing. So
Yeah.
your instincts are telling you just not worth it.
Yeah, I just don't do it anymore.
Shelby wants to know, you answered this question, how long you were in the hospital after surgery. You said 6 days?
6 days, yeah.
And then like a 6 to 8 week recovery?
Correct.
Becca wants to know, how did you handle the side effects of chemotherapy, especially being a dad to 6, you have a full-time job, you have a wife at home?
It was tricky. My wife definitely helped out. She was amazing through the whole process with a lot of the kids' things. I did have to kind of learn how to manage what I was doing. There was times where I knew I couldn't be as active as others, and but I was always there to be my kids' dad. If they ever needed something to talk to me about, I was always there for them. So.
And you're a dentist.
I'm a dentist. One thing that did happen with the chemo is I had some neuropathy develop in my hands and feet, and some numbness developed. So I did not work, and it's been a challenge getting back to work, as you might imagine. Not being able to feel my hands is definitely poses some problems with being a dentist.
Right now, can you not feel all your hands, your fingertips?
It's the majority of my hand, and I can't feel my feet at all for sure. So,
wow.
But it's something that I am not upset, or I mean, I'm just happy that I'm alive, basically. So
you can feel the rest of you, but that's
yeah.
still a lot. That's a tough reminder.
Yeah, I mean, it's a reminder, but it's all in all, I feel very, very, very fortunate. So,
Linda has a question for you. Linda wants to know, what's the best advice you have to help someone who's newly diagnosed?
I would say just to be as positive and hopeful as you can be. I really think that's a powerful thing. So I know it's hard, but it just trying to stay positive, I really think is a big factor in it.
Is there something that you really appreciated when you were really in the weeds that other people did or someone else did that you would say, gosh, if you know someone going through this, do that?
I think I had so many friends and family reach out to me and give me words of encouragement, from people that I see every day to people I hadn't seen in years, that I couldn't tell you how much that meant to me to have people at least tell me that they were thinking of me and knew that they cared about me. So, and it was nice having friends. I had friends or family reach out, and when I was feeling up to talking about things other than cancer too. I mean, I had a friend that would call me every week and talk about basketball, and that was nice just to have somebody to talk to that would take my mind off of some of the things I was going through.
Someone to do something normal.
Yeah.
To just keep going and get
just
your mind
feel like
on
a
other
normal
things.
human being and not be worrying
Right.
about cancer and chemo and all the other stuff that you were going through. So.
You have such a new level of understanding now that you've walked through the fire.
Oh gosh, whole new perspective on what it means to go through having cancer versus what it means to just living life. It just definitely a new perspective on a lot of different things.
When it comes to today's takeaways for our viewers at home watching, what's the one thing you wish people would take away from this?
Well, I'm excited with all the new advancements. Dr. Kasi was talking about all these vaccines and all these new advancements. It really seems like there's been a lot of those in the last 5 to 10 years, and I hope that gives people the opportunity to get treated for cancer that may have otherwise not been able to in the past. So hopefully it provides some hope to people.
Dr. Kasi, what do you want viewers at home to know?
Yeah, I mean, I'd like to echo Chris's sentiments. And, we're in the era of precision medicine. We're an NCI-designated comprehensive cancer center. So I think we have new tools, new treatment options, clinical trials. After surgery, checking circulating tumor DNA test to look for these circulating tumor cells that we want to take care of, and considering clinical trials such as the vaccines or other forms of clinical trials to ultimately make patients live longer and live better.
Longer and better, and then get back to the lives that they were already living, and you're a walking, breathing example of that. Dr. Kasi, thank you so much for joining us and being so generous with your time. And Chris, thanks for sharing this.
Oh, you're welcome.
You have a beautiful family, and they must be so happy to have you out of the woods.
Yeah, they are happy.
Back,
I'm excited to be back, so thank you.
Thank you to our viewers for being with us here today and joining the conversation. We will see you right back here tomorrow morning.
Why do married people live longer? What does a loving relationship do to the brain? Does sharing a bed actually improve sleep health? I'm Jessica Lovell on the next Open Mics with Dr. Stites. The Science of Love, the surprising health benefits of a loving relationship. Wednesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.